Hi, Lindy. Thank you so much for agreeing to sit down with me and give me your feedback about the emERge-NC mobile app.
You're welcome.
Working in the healthcare industry, I've noticed that many patients with employer-sponsored insurance use the emergency department when suffering from non-emergent medical issues. So before I get your input on the mobile app, I want to ask you a few questions. In front of you, there is a green and pink index card. I'm going to call out some common symptoms, and I want you to lift up the pink card if you would go to the emergency room, or the green card for urgent care. For the sake of this video, we are assuming you can't get into your PCP right away. Okay?
Okay.
Alrighty. So if you were suffering from back pain, would you go to the emergency room or urgent care?
Urgent care.
Okay. Nausea?
Urgent care.
Chest pain?
ER.
Vomiting?
Urgent care.
Diarrhea?
Urgent care.
Minor headaches?
Urgent care.
Okay. Bumps or scrapes?
Urgent care.
Difficulty breathing?
Probably urgent care.
Okay. Fractures or possible broken bones?
Sometimes urgent care, if they can't do it, they send you to the emergency room.
Okay. Pink eye?
Urgent care.
Fever?
Urgent care.
Okay. Ear pain or sinus pain?
Same. Urgent care.
Okay. Stroke?
Emergency room.
Okay. Cough or sore throat?
Urgent care.
Animal bites?
Urgent care.
Okay. What about a minor car accident?
Maybe urgent care. Maybe it depends on the
Okay.
ER or urgent care.
Mild asthma?
Urgent care.
Okay. Severe bleeding?
Emergency room.
Okay. Allergies?
Urgent care.
A rash?
Urgent care.
Okay. Head trauma?
Probably the emergency room.
Okay. What about minor burns?
Urgent care.
Okay. Loss of vision?
Maybe the ER.
Okay. And what about if you needed x-rays or vaccinations?
A lot of urgent cares can do that.
Perfect. Okay. So good job. About 6 of those they consider an emergency. So thank you so much for your input. So now we're going to get to the emergency app. So I know you say that you are not technology savvy.
That's correct.
Okay, so if you already, or if you were going to download this app onto your phone, okay, so over here on the left with the blue, that is going to be the main page when you open the app. So from looking at that, what do you think of it? Is it easy to find where you would want to go? Does anything stand out to you in the beginning of the app?
I think the emergency buttons they show up really well.
Okay. Okay, so just from looking at that, would you probably be able to navigate where you wanted to go if you were looking at? Okay. Okay, and then in the middle of this page, it's going to show you, this is where the symptoms are going to pop up. So I have 2 examples. There's one where all the symptoms are listed there for you and you just click yes or no. And then the one on the bottom is where you can manually put in the type of symptoms you're having. What do you think about those 2 descriptions? Which one do you think you would rather use?
I probably would use the one where you put in the symptoms.
Okay. Would you like it if when you put the symptoms in, it also prompts, like say you have a fever. So if you specifically put in the prompt of fever, would you want something to pop up then asking how high is your fever? Or do you think it would just be fine just for fever and then just to click on?
I think it would be good to have the how high is your fever.
Okay. Okay, and then over to the right, those are examples of wait time. So once you list all of your symptoms, there's going to be a screen that pops up suggesting whether you might want to go to the emergency room, urgent care, and it might offer some telemedicine options as well. So say you enter your symptoms, it pops up saying urgent care would probably be your best bet. There's two options right there. One lists just the title of the urgent care and how long the wait is, and then the other one has a map attached to it as well that would list how close the specific locations are and how long the wait is. Are there any ones you prefer?
Probably the, well, either one would tell me a little bit about how close they are, but I think this is easier to see, you know, the actual minutes.
Okay. So you would be fine with it showing up like that because it's easier to read, and then maybe give you an option of clicking on it, and then it would maybe give you a map of how close it was to you?
That would be
okay, perfect. So just from looking at this, is there anything else you as a user would want to see on this app?
I probably would want to know if my insurance would cover it, and if so, how much, if they know how much the deductible is.
Okay, so you'd feel comfortable entering if there was an area on the app asking you to enter your information for your insurance, you would feel comfortable putting that in and then letting it list out if certain places accepted that insurance and how much a copay might be?
Yes, as long as it's a secure link.
Okay, perfect. Well, thank you so much. I appreciate all of your input.
Thank you.
All right,
Have a good
thanks.
day.
Thanks, bye.